Hi folks, welcome back to Coffee with Ravi. Today we're talking about an important topic which is preventing of falls for all of us as we grow older at home. This is pertaining to all of us that are living at home and not living in nursing homes or other facilities or in the hospital. The common causes of falls are multifold. About 29% of people have a fall after the age of 65, and a lot of money is spent dealing with the consequences of falls. And it's a very personal note to me because both of my parents have fallen. I've continued to work with them as they've gotten older to prevent them from falling. Falls also cause a fear, which then feeds into inactivity cycle so that people don't exercise as much because of fear of falling, etc. Not to mention the fracture problems as well as problems with the muscle actually dying when that happens. The number one cause is balance and gait problems. The balance and gait can be assessed very simply by a test called timed up and go, where if you take more than 12 to 15 seconds from the standpoint of getting up from a chair, that is an indication that one is at risk for falls. The main important thing we can do is exercises that strengthen the muscles. I have a slide in here which shows that can be either group exercises, home exercises, very simple exercises such as getting up from a chair so that the muscles of the trunk are exercised, the muscles of the legs are exercised, and there are several balance exercises one can do which can be as simple as walking on a beam, walking on a straight line, and you can take it all the way to yoga or Tai Chi exercises that you can get at the YMCA or the rec center that can help improve balance. The second cause that we need to check into is vision problems, cataracts, or not being able to see things clearly because the glasses are not adjusted, or wearing the wrong kind of glasses when we are outdoor. All of these can lead us to have vision problems which then lead to falls. So keep an eye on the vision. The other aspect is orthostatic hypotension. It's a fancy word for blood pressure dropping when we get up. Sometimes that happens because of medications, sometimes that can happen because of medical conditions, but if you are ever feeling lightheaded when you get up, that's a risk factor. Bring it to the attention of your doctor. There are remedies for that. The third aspect is different medications. Commonly used medications such as antidepressants, which we take for depression, medications which are used for anxiety called benzodiazepines, water pills. These are the ones either by causing dizziness or by causing a little fogginess of the mind, sometimes can cause falls or put you at risk for falls. The fourth important factor is what's happening in the home environment. So loose rugs, low-lying tables, anything that we can stumble across is a risk factor for falls. So think about that. Think about installing grab bars in the bathroom or aspects that can actually help us within the home environment, making it safer will prevent falls. My last post last week was on dementia, and that continues on this, where if one has slow onset of dementia or cognitive or brain slowing, that can be a risk factor. So be sure to ask your primary care provider whether you're being screened for dementia by means of questionnaires. There are several questionnaires that can be done for this. There are several important resources which include U.S. Preventive Services Task Force and the American Geriatric Society and the British Geriatric Society that have more information on fall prevention and what one can do. Lastly, don't forget, if one has thin bones or osteopenia or osteoporosis, great attention has to be given to that as well, because if there is a fall, one can have bone breaks that can happen, but that will be prevented both by treating osteopenia or osteoporosis, but any kind of exercise, movement, taking enough calcium, etc., help with that aspect of that. So in summary, many different forms that we can think about, things that we can do in the environment, things that can help us with balance, things that can help us with the blood pressure, looking at medications. all of these, I think, can help prevent falls. So thank you, and as always, look forward to talking again next week.